NCLEX question of the day. Let's go over it. Remember, all of these questions come from my free test bank. The link is in the bio. The patient has recently returned from having a thyroidectomy. The nurse should keep which of the following at the bedside? Where is the thyroid? Is it here? Is it here? Where's the thyroid? What is right behind the thyroid? Okay, let's visualize this and then answer the questions. We have a tracheostomy set, a padded tongue blade. That's never the answer. If you ever see that, it's never the answer. An ET tube or an airway. Those are kind of the same, aren't they? If we have two answers that are the same, we can eliminate them both as incorrect answers when it's multiple choice. So now we're left with a tracheostomy set and a padded tongue blade. You like that little test strategy? I also teach that in my program. All right, so we know that it's never a padded tongue blade anymore. That's like something from the 50s. So we would have a tracheostomy set. Why? I'm making myself laugh. Because you are at risk for tracheal edema, essentially also just being so swollen and then it closes off the airway. So having a trach set right there after you have a thyroidectomy is very important. I hope this helps. Again, if you want access to these questions, go to the link in my bio. If you're interested in my NCLEX program, there's also a link there to that. Good luck, guys.